Bismillah ar-Rahman ar-Rahim. Thank you very much for Dr. Wasila, your kind invitation and your moderation of this session. And let me summarize to you a trip which I have done about 6 months ago to a center in London where they perform the highest number of HIFU cases worldwide by Mark Whiteley. I can't see my presentation yet. I just would like to mention, yeah, that's the one. I did have a very high expectation when I went to HIFU course, especially this course is about 4,000 British pounds. You can see how expensive it is. So I really did have a high hope that it will solve all my venous problem, but actually it didn't. And let me share with you my experience. So what I have learned from this course, this is my internal learning objective. This is a machine which is around 60 million Egyptian pound. This is the robotic arm and this ultrasound, and then the firing of the HIFU, high frequency ultrasound. The place is in London, in Guildford, and the course is by Mark Whiteley, and this is the place that you take the course. The second, third floor for inpatient, first floor is for operating theater. The company is called Theracleon. This is a new era of therapy where you don't have the patient to have anesthetist or to wear anything, because this is completely, as Professor Wasila said, non-invasive, non-thermal, and non-everything. So non-puncture, no puncture at all. And this technique, the product is a machine called Sonovane, but there is another machine for thyroid as well. This is the beauty of the Sonovane. No surgery, no infection, non-invasive, completely non-invasive. So patient can come with their trousers and just go home after 1 hour, and that's it. This is the beauty, because we haven't done that before. Now, this is a machine of 60 million. It's a robotic arm, ultrasound. It basically have a high intensity beam directed toward each other, and this will evaporate the blood in the vein and coagulate it. This is a mechanism of action, as I have mentioned, and this is the area where you will see ecotherapy. It started by varicose vein, it will go to thyroid, it will go to breast, and it will go to more indication. Now they are trying it on liver cancer. So this technique of high intensity is definitely here to stay in medicine. They did have a problem with the procedure time. It usually takes 2 hours, but now they were able to cut it down to 30 minutes. So the procedure take only 30 minutes of HIFU. What happened to the vein? Because this is a pathology that we didn't know before. We know that you get a necrosis in the vein, but we don't know what happens if you have high intensity ultrasound beams. This is the same what you use in your duplex scan every day. But if you have a high intensity, then you get degeneration with what is called hyalinosis. So the secret is getting a hyalinosis, which is a pathology specific for HIFU. So this is by having the pathologist to get to see, but we don't get material obviously, but this is what happened on animal model. The endothelium is intact, but adventitia media get hyalinosis. So the advantage is there is no wound, it's outpatient, you don't need anesthetist, there's no age restriction, you don't stop anticoagulation, you take Marivan or whatever it is, NOAC, whatever you do, and there is no age restriction, no compression afterward. So you can see the advantage is huge, and you're back to normal life. I've seen they have done 5 live cases on that day. They go to the work on the same day. So patient come in the morning, have a bit of 2 hours leave from work, and then after 2 hours, he'll go back to his office to work. This is very impressive. We don't see this by EVLA. Now, this is basic, the technique. The technique, it will have an area under the skin, which is 9 millimeter in diameter. Everything there will be vanished, will be gone. But it cannot treat the skin and cannot treat 7 millimeter under the skin. And this is in our outpatient clinics, this is the main multiple patient. So it cannot treat telangiectasia. It cannot treat any vein 2 millimeter under the skin. And this is a big disadvantage. But anything from that area can be vanished. This is Mark Whiteley. He done 5 live cases, just coming from the clinic straight away, and he start putting the machine. This is a robotic arm, so the machine takes the duplex, know exactly where is the great saphenous vein, and it will track the great saphenous vein. So the first, I think, technology that AI will replace us is ultrasound duplex scan, unfortunately. But I hope to have an AI which is as good as Professor Wasila, which will take maybe 50 years to have that. So the AI will discover to you, this is the SFA, this is the diameter, this is everything, blah, blah, blah. You just press on one button. So one button, what you press on it, I just want you to see, this is the detection of the great saphenous vein. You just press a single button. And this is the treatment of the patient. It actually can be done not with doctor, it can be done with nurses. Actually, Mark Whiteley doesn't do it. Yes, I have 1 minute and 20 seconds. That's plenty. So Mark Whiteley doesn't do it, but his nurses do it, which is not a graduated doctor. He treated the varicose vein with it, and she's very happy. She's taking good income out of it. And because you can't really go wrong, because artificial machine will prevent you from doing anything wrong. If you are not in the right place, not in the right dose, the machine doesn't work. You see how beautiful it is. So hopefully nurses in our hospital can deal with varicose vein in the future. So this is my conclusion, and I have plenty of 50 seconds. No single answer to all varicose veins. So if you think a HIFU will solve it, is not. Sure, HIFU will have a place in the future. No question about it, because of the beautiful advances that I have mentioned. Cost definitely is an issue, because this is 60 million Egyptian pounds. And thank you very much.